right, hi everybody. My name is Vanessa Smith. I had the opportunity to work with BC Healthy Communities for the last 3 months or so, and my practicum-based case, I named it Research to Reality, Translating Data from Endless to Aging. So as I said, I worked with BC Healthy Communities, which is a nonprofit based in Victoria, British Columbia. Their mission is to promote the healthy communities approach, offering a shared platform for dialogue, collaboration, learning, and action. So to achieve this, they offer things such as curriculum development, leadership training, research and evaluation, facilitation, consultation, and community planning. So my practicum-based case was to create a fact sheet on social isolation and loneliness in British Columbia's community of older adults. This was going to be the start of a wider think piece that the organization would be offering in the coming year. And during this fact sheet, I needed to answer questions such as, what is social isolation and loneliness? What are the differences between the two? What does an age-friendly community look like? How can BC and Canada learn from international examples? What recommendations do I find? And what do we currently offer throughout the country? So that sounds great, but what I found is when I told people that, their eyes kind of glossed over and they said, cool, and then they left it at that. So I've learned that I need to explain that a little bit better. So the first step in what I did is I did a lot of research. So I spent many hours at the beginning just accumulating as much knowledge as I could about social isolation and loneliness. And then I needed to narrow that down to credible sources. So that got rid of a lot of the research that I had done. And then I needed to gather data that I found relevant, cross-check that data with other facts that I found, convert all of that data into 1 or 2 sentences, and then make those sentences easier to understand. And one thing that I had to think about the entire time was who my target audience was. At the beginning, I started focusing on public health professionals, but what it really turned into was focusing more on older adults and their family members. So I had to keep both of those in mind. Great, so I'm gonna give you a quick example here just to make that a little bit easier. So this is great. This is from the Government of Canada, but that's 1 sentence. This is an original sentence that I found. I know we all love long sentences, but we are not my target audience. Older adults and their families were. And I probably wouldn't read this if I was an older adult. I'd skip right by it. So this is what I came up with. Recommendations: more government and community partnerships, educate about the benefits of social inclusion and engagement, celebrate diversity, and be realistic. It is my understanding that plain language not only easier to read, but it works for all levels of health literacy, and it includes professionals in that as well. It offers the same amount of information, just in a different way. So here are some quick numbers for you. I turned 63 online journal articles, 21 websites, 6 back and forth phone calls, 37 back and forth emails into 2 pages. Great, so why did I think creating this fact sheet was important? Thought it leveled the playing field for people with all different health literacy levels. It introduced the rest of the think piece for the other people that I worked with in the organization. It can be accessed online or in print, and it hopefully increased health literacy. And with the access online or in print, it actually really goes back to Sarah's presentation about I was working with a lot of older adults in rural and remote places, and they don't not only have kind of not great access to the internet, but sometimes they choose not to, or they want to get that information in person. So here are some of the values that I used: partnerships, diversity, and interprofessional practice. The ones that I really wanted to pay the most attention to is acknowledging how multicultural and diverse BC's older adult population is. Being aware of ageism in the words that I used, and also from the journals that I used. If I thought that they had an ageist tone, I just got rid of them. Also, I needed to understand that my fact sheet would be read not only by older adults and their families, but public health professionals such as social workers, community support staff, clinicians, program managers, community planners as well. And I wanted it to be equally informative for them. Anyways, I just want to say a quick thank you to my supervisors at BC Healthy Communities, the public health and policy staff, and of course my peers and my family. Everyone's been very supportive, and I am incredibly grateful. Thank you.
Thank you, Vanessa. Are there any questions?
This really resonates with a project that Danielle and I did. Where's Danielle? Is she around? Where? Do you remember? And did you find anything else about the social inclusion of adults that was really pertinent, you know, that you could help them with?
I think that would have been kind of the next step of this project. So right now, this was very primarily research-based, is what I found, is I was just trying to gather as much research as I could. And then that research was going to go towards the people that would implement that research into more of a reality. So I guess research to reality isn't the greatest headline because I didn't do any reality, but it almost rhymed a little bit. And I think that that would kind of be the next step. But one thing that I really did find and stuck out to me were the connections between mental health and social isolation and loneliness. And that was one of my recommendations, is I think especially with older adults, they need to look more into the connection between mental health issues, losing a partner. And I feel like that's sometimes glossed over because it can be tricky to talk about with older adults.
Mm-hmm.
Yeah.
Thank you.
Any other questions? I just have one quick one, and that is that did you find any relationship between plowing through all this material and feeling isolated?
Yep, a little bit. I actually did part of I moved about a week before starting my practicum in Victoria to Vancouver, which was a surprise to all of us. And it was kind of isolating reading, 8 hours a day, 2 days a week in Vancouver in my little home studio or whatever you call it. That was really difficult. I think if I was able to have, about half the time I came to Victoria, but if I was able to have that kind of water cooler conversation on a more regular basis, or talk to more older adults in Victoria about their experiences, I think it would have been a little bit less isolating.
Okay. Thank you, Vanessa.
Great. Thank you, everyone. Okay, thank you. Thank you.